much, ladies and gentlemen, for watching Imani Television. This is your #1 TV station that builds your faith in Jesus Christ. Once again, welcome to Health, Hygiene and Wellness. This segment that comes on your screens every Monday at 7:30 p.m. So welcome to this new episode. My name is Barasa Saenyi. Today in our discussion, we'll be discussing about teenage pregnancies. I'm privileged to have Dr. in the show. He will be telling us more about teenage pregnancy, the impact on our society, the impact on our nation, the complications on the teenager, and all that. So stay tuned to our discussion till the end so that you can be informed of teenage pregnancy, how we can handle it in our community, and all that. So welcome, and I take this opportunity to welcome Daktari. Karibu sana Daktari.
Thank you so much, my brother.
Yes.
Yes. I'm also privileged today to be in this beloved studio.
Yes.
That is Imani TV.
Yes.
Yeah, today is the day for the mothers, and specifically we want to discuss about teenage pregnancies.
Yes.
That is globally, Kenya, and more so in Trans Nzoia, and how the government is working to make sure we reduce what's the impact and all those contributing factors. So thank you for this opportunity.
Yes.
I believe people are going to learn. Thank you.
I had forgotten, he's Dr. Julius Wachiye. Maybe you can tell them where you work from or something like that.
Okay, thank you. My name is Wachiye. They call me Dr. Wachiye. I work in the Ministry of Health, Trans Nzoia County, and specifically in Kimenini Sub-County, coordinating health promotion and education services. That is education about health matters in the community, to the public, so that we're able to prevent those the deaths that come because of the health conditions. Yeah.
Okay, so welcome Daktari. Let's just dive in straight away. Make us understand what teenage pregnancy means, and yeah.
Okay, thank you. Now, teenage pregnancy. When we talk of teenage pregnancy, we talk of the pregnancies that happens below 20 years of age. When you look at women of reproductive age, in Kenya, basically we'll be looking at 15 years to around 49, but we have those who go to around 52 years, but basically we look at 15 to 49 years. But apparently, globally, looking at it, we realize that reproductive age has when we come to a lower age of about 10 years. We've had girls who have delivered at age 10. So globally, they basically look at the pregnancy that happens in our girls, that's between the age of 10 to 19 years. But more so in Kenya, basically the more pregnancies, we look at them from 15 to 19 years. Well, that is basically where majority of our girls or our ladies get to the teenage pregnancy. That's where they start experimenting and they have those teenage pregnancies. So ukisikia teenage pregnancy, just know that is our girl or our daughter who got an early pregnancy when her age is still under the age of 20 years. And looking at health, we advise that someone should get pregnant once she's above age 20 years. And health-wise, between age 20 to 34 years, that is the good age for these women to get pregnant. But beyond 35 years, yes, you can get, but it's not healthy. But and below 20, it's not healthy. So for today, we shall narrow down to those pregnancies that are below 20 years, so that we'll discuss about them in broad.
I'm glad that you've explained it so widely that our viewers can understand what teenage pregnancy means. Now, what are the statistics for pregnancies right now, maybe globally or here in Kenya, about the teenagers?
Okay, thank you. Looking at the whole world, apparently now we're having about 22 million between those age.
Globally?
Globally. We're having about 22 million teenage pregnancies that are happening. that means that is a very huge number in comparison to what we expect.
Yes.
So, and globally, it means Kenya, Trans Nzoia being included.
Yes.
Then, when we look at this teenage pregnancy, we realize that about 12, about half of them, that is 11 million, they don't plan to have them. So, which means these pregnancies are happening, and most of our girls, they don't want them, which means there is a risk of procuring unsafe abortion. Then looking at them, this teenage pregnancy, you realize that about 55%, 6 out of 10 ladies who get pregnant, 10 ladies, I mean 6 out of our girls between the age of 10 to 19 years,
Yes.
6 of them, they end up in procuring unsafe abortion. So which means only 4 carry the pregnancy to term. Then now when we look at it from the health perspective of maternal health,
Yes.
it means that maternal health is at risk, and it means that we shall lose more mothers as compared to what we expect. We expect that the WHO, the World Health Organization,
Yes.
expect us that we make sure all our mothers are safe, they carry the pregnancy safe.
Yes.
But now when you look at now the big 5 causes of maternal deaths, number 1 being bleeding a lot, number 2 being hypertension, high blood pressure that comes because of pregnancy, number 3 is infections that come because maybe they live in a bad environment, unsafe environment.
Yes.
Number 4 is unsafe abortion. So which means when you look at these statistics, 6 out of 10 they procure unsafe abortion. It means we are losing our mothers, and yet these are the causes we're able to prevent them. So now when we narrow down to Kenya, to now Africa, you realize now, looking at all these teenage pregnancies, they happen more in Africa than in the other continent. So in Africa it means Kenya is being one of it, and Trans Nzoia is not exceptional.
True.
Then now when we come down to Kenya, we realize that out of 10 mothers who come to clinic or who come to deliver, 2 come, two that comes to deliver or for antenatal care are teenagers. So to be specific, looking at Kenya, the teenage pregnancy rate, we are at 15%. Then now when we narrow down to now Trans Nzoia, we realize that 18% of all the mothers who come for care are teenagers. So out of 100, when we look at a facility like Wamalakijana Teaching and Referral Hospital, that is our referral hospital. In a day, they see about 100 plus mothers. Then when you look at the statistics in the record, you realize that about 18 or about 20, let me say so, about 20 are teenagers. And WHO recommends that every country, every county, everywhere, they should strive to make sure that teenage pregnancies are below 5%, which means out of 100, those who come to facility that are teenagers should be only 5, less than 5. So when you look at the Sustainable Development Goal of ensuring that we have safe mothers, and Vision 2030 to make sure that we have mothers who are healthy and who give back to healthy children, you realize that we are far away from hitting the target. Which means Vision 2030 is just about 4 years to come. Which means we are still very far, because as Trans Nzoia, we are still having those so many things. And when you compare national statistics and county statistics, you realize that now it looks like Trans Nzoia, we are the ones pulling the country down. Because the country is at 15%, and the county we are at 18%. So which means as a county we have a big role to play. So we must ensure that everyone plays part in ensuring that we reduce this teenage pregnancy. This means that every stakeholder, the media must be involved. We thank God that our favorite TV station, Imani TV, is giving us the opportunity to educate the community, and at the same time it's airing this to the community so that they see what is happening in their county. Then other stakeholders, it means that everyone in the community must know that teenage pregnancy is a health threat. When we look at what we call the triple threats, I mean teenage pregnancy, HIV infections, then that's new HIV infections, and gender-based violence cases. These are the things that, as Kenya, we have committed to the global agreement kwamba we must work to reduce them, because Kenya, we are not exceptional. We must work to make sure that we reduce those teenage pregnancy. We must work to make sure that we reduce new HIV infections. Yes. We must work to make sure that we reduce gender-based violence. Wababa, kupiga watoto, mabibi, and so forth. We must work to make sure we reduce those. So looking at those statistics, it is alarming that we must be strategic. We must have strategies to make sure that we reduce this. One of it is to make sure making sure the public is aware. They have to understand that we are having this high number of teenage pregnancy. And in Trans Nzoia, when we look at our sub-counties, we have about 5 sub-counties. We have Kiminini, Endebess, Cherengani, Kwanza, and Saboti. When you look at data for 2024, by the end of 2024 December, yes, the sub-county that was leading teenage pregnancy was Endebess. Then we have Cherengani, then we have Saboti, Kwanza, Kiminini. But now, when we look at this in 2025, we are realizing that the trends now have started to rise. We are no longer at 18%. When you look at data for January, February, March, we have realized that we are now going to the worst. We have moved to now 19%. We're even going towards 20%. So this is an alarm that we have to have strategic measures that could make sure we reduce these teenage pregnancies.
Among the 5 sub-counties, I'm interested to know which one is the leading one.
So this 2025, Saboti is now coming up and really taking the lead. We look at the areas of Kisawai ward. We look at this data even at ward level. We look at Kisawai, when we look at Saboti, those sides of Gitwamba areas, that they are really having a lot of teenage pregnancy. Even recently we went there and did a dialogue with the community so that we discuss what it is that's contributing. And that's why in this talk we have to talk about contributing factors so that everyone is aware, so that we work together to make sure we address those contributing factors and we reduce this declining trend.
I would like you to address the contributing factors, and as you do that, I will also want you to make us understand why is it that in Africa we have these huge numbers of teenage pregnancies than the rest of the world. Is it something uniquely made for us, or there are some contributing factors, as you will mention, about that makes Africa unique for us to have these teenage pregnancies as high numbers it is?
Okay, great, good question. You realize that in Africa there are more cases of teenage pregnancy. Looking at Africa, we have a lot of diverse cultures. Some of them are we call them Zingothropers. They're old school. These cultural practices. One of early marriage. We have places where early marriage is not a big deal. We have places where, like even in Kenya, once a girl is at 12 years, you are paired to a man. You are told that is the man who will marry. And you know this man is older. He's old enough. So those practices, African cultural practices, they are contributing. They're really contributing. Then still in Africa, Kenya being included, we have, when you look at literacy level compared with the white, you realize that in the white, the other continents, you realize that people are more educated compared to us in Africa. And why? One of the reasons is poverty. When you look at Africa poverty level, poverty index is high compared to the one in the West. And even in terms of the health, health-wise, how our children grow, how they are nurtured. You realize that in Africa, because of those cultures, we are not educated. We nurture our children in the wrong way. If I can narrow down to where I come from,
yes,
where this name Wachiye originates,
yes,
yes, we have cultural practices where once a boy has been circumcised, yeah, has come, has been circumcised, yes, then the boys influence each other that, and you even hear the aunties saying, we are not sure if this child is boy is function.
it's
Yeah.
fun.
So what are we saying? This boy should go and experiment to a girl, so that we see if we can have, if we can impregnate the girl, then that is when we shall celebrate, clap, and say that now our boy is functional.
Yes.
Yeah, the gadget is okay. Testing the gadget.
Yes.
Now the gadget is okay. Those practices, Kenya being one of them, they are retrogressive. So you realize that they really contribute. But now, if I can talk wholesomely on the contributing factors,
Yes,
illiteracy,
the literacy
our
levels.
children not going to school contributes a lot. Because when we analyze these pregnancies in our girls, they are higher in those girls who didn't go to school compared to those girls who went to school at tertiary level, that is at college level.
Yes,
Yeah, a girl who is a standard 4 dropout will not negotiate for a safer sex compared to a girl who is at university or who has completed university. Because the one is sharp enough, he knows the complications, knows the health risks, and the other one doesn't mind.
Yeah.
As long as she has been given 50 bob,
It's
to buy
fine
for
and
her pads or to buy those sweet things,
Yes.
then she just gives in so that the boy impregnates. So because of that, illiteracy in Africa and even in Kenya and even in Tanzania has contributed. Then another thing, the main thing, and this one we even got it from our girls themselves. We normally do what we call youth dialogue days. We go meet the youths, we discuss on how to prevent pregnancy. Then we meet those who have been impregnated earlier. Then we interact with them and find out what makes them now get this pregnancy. Almost all of them, they say their parents have ignored them. They don't provide for them. So this parental ignorance and guidance lacking is making our girls now, and even our boys, because a good number of those teenage pregnancies, the perpetrators are their colleagues, their boys. But a good number, but the more a good number, in fact, it's more for for the adults who just look at these children, then they give them something small, then they end up having pregnancy. So parental guidance is very key, and it's really doing us badly, because now our parents are not sitting with their children to guide them. Our parents are very busy. They leave the house in the morning, they go to hustle, they come in the evening. Yes, the house helps are the ones staying with our girls. House helps, do you know, once the master leaves, then they put on TV stations, some play
secular music.
Yes, secular music,
Yes.
and they influence. So in that process, our girls and boys, they are lacking those parental guidance, the values that we expect them in the society, so that we have a healthy society, is lacking. And because of that, it's really doing us badly. Then another thing that is somehow unavoidable, poverty. Looking at poverty level in Kenya, you realize that not all of us were able to take care of our family because of one or two reasons. So we don't know everything God plans. Then because of that, the father is not able to provide for her daughter to get the pads. The mother is not even able to provide. Then what happens now? This girl starts vibarua, going to look for alternatives. At the end, maybe this girl goes and misses to get. Then at the end, she gets an older man who gives her something small. Then at the end results, we end up having that. And another reason why we have those teenage pregnancies, you realize that Nakada gave us a report on drug and substance abuse.
Yes.
And something amazing is when you look at drug and substance abuse, a good percentage of our girls start alcohol, if I can narrow down to alcohol, as early as at age 6 years. 6 years.
Girls only or even boys?
All of them.
Yeah.
Why? Alcohol is in the fridge. That is one. Or alcohol is just available in their house. In fact, maybe the main store is in their bedroom. That's where they hide that alcohol under their bed, maybe because the parents sell the alcohol, the local brews. So what happens? Or the father tells the boy to bring alcohol for them, then the boy starts testing. So we realize that a good number starts at age 6 years to test. So what does it mean? As parents, we need to be very careful with what we do. Yes, we know you have to enjoy your life, but we have to keep in mind that we are having minors who are still, they don't know what's their direction.
Yeah.
Because they are seeing you taking alcohol, they will experiment. So because of that, now we are having drug and substance abuse as one of the contributors for these teenage pregnancy. Yes, once we have, once these people are under influence, their judgment is compromised. They won't see that the girl beside him as his sister, and vice versa. They don't see as his brother, her brother. Now, in the process, they'll end up doing sex. And in that process, we have those children. So we are having those. And apart from that, another contributing factor, because of the culture and that, we have places, and even this one I've already talked about it. The culture makes supports early marriages. Yes, and because of those early marriages, then because a girl gets married at 16 years, what happens? We expect once someone is married, we expect a baby. So in that process, we have a good number. They contribute a lot in terms of making sure we have. And health talks or just that talks, guiding and counseling is also not in our parents, is also not in our social places where we expect people to go so that they are nurtured the right way. What does it mean? At home, parents are not giving guidance on the health guidance
to their children.
Yes. In church, maybe the children are not going to church, or if they go to church, they just attend a mass, a general mass, or a general church service. Yes, then they go home. We should have those Sunday schools intensified in our churches.
Program that specifically talks about
teenagers talk about the right nurturing, the values, so that our children grow up knowing that it is bad as a mere boy, impregnating my sister. It is bad if me as a girl, I get this early pregnancy. If that happens, all our children will grow knowing the social implications of these early pregnancies, the health implications, the complications, and everything surrounding, even including affecting their dream, their vision. They will know that. They will stay focused. So because of that, those lack of health talks, we realize that we have those teenage pregnancies. Another thing that's now happened now, this one is in the community.
Yes.
You have the perpetrators who have impregnated our girls. Then we have the law. But now the law is not being enforced. Yes, we have those cases. They come to our hospitals, we write the medical report, the police now get hold of them. But now because of kangaroo courts, the chief, the Mukasa, and other local leaders, and even the parents themselves, they come and start saying, now we can negotiate. Then, because of poverty, someone is given some money, then the cases ends there. What does it mean? This now will encourage the perpetrators.
As long as you have money, you can.
As long as you have money, you can impregnate everyone in the village. Then the cases will just end there no one will be prosecuted and face the law. So because of that, we are having those challenges, and once those happens, we're having them. And above all, because of the policies, restricting policies about the teenagers. One of the challenges as health practitioners is those restrictive laws on laws and policies on teenagers about contraceptive health talk. Yes, because this is a teenager. Well, we don't want to discuss about it because we expect a teenager to go to school and finish school. That is when we can discuss about that. But vice versa happens. A girl is 15 years old, she's already pregnant. Yes, the law says above 18 years, that is when someone can discuss about even contraception. But now, a girl at 15 years, she has a child. At 17 years, she has another child. This is a.
But you don't want to talk about.
But we don't want to talk about family planning because the restrictive laws.
Yes.
We have adolescents and young people policy that the rules that make sure that we don't discuss about. So now we shy away from it, and in that process, we continue having teenage pregnancies, and now burden after burden, economic burden continues and worsens. So we suffer among so many factors contributing. We have those early relationships in school. Yeah, social media affecting our girls. They see now they can experiment, sex and so forth. So we have so many things. We are staying in a world where everyone that the risks are all over from every angle. So it's high time our people knows about this teenage pregnancy, knowing that the reason we're discussing about teenage pregnancy now, why discuss this teenage pregnancy? Because we want to make sure that everyone is empowered, so that we address it from wholesomely from every angle, so that every stakeholder takes part in health education and even in referral for health education. Referral is part of management. The aim of this discussion is we are looking at it from the maternal health perspective. Looking at it that teenage pregnancy has so many complications that leads to maternal deaths, and we don't want maternal deaths to increase.
Okay.
Thank you.
Can we also list this rural and urban factor as a contributing factor for teenage pregnancy, whereby someone is living in the urban areas, others in the rural areas? What's the difference, or how can you?
Yes, thank you. Good question. Now, when we make a comparison of rural and urban, you realize that urban areas, people are educated. Yes, people are educated, and people don't interact much because everyone with his family, we have gated homes. So because of that, people are knowledgeable, people are exposed to all these social, because if it is the internet, it's there. So we realize that when we make a comparison, those staying in the rural, because if they lack all those things that we have discussed, we have more teenage pregnancies in rural as compared to those staying in urban, because urban they can access education and so forth. But at the same time, when we look at it from now, the parental guidance part of it and social media aspect, we realize that those in urban, they are exposed to social media, so they are prone to also experiment. So all this environment it poses our girls at risk. So that's why we have to address the contributing factors wholesomely, and every stakeholder must take part in it.
I see when we talk about the rural and urban factor, we go back to literacy.
Yes, we go back to literacy, parental guidance, poverty, kangaroo courts, boy-child nurturing, wrong nurturing, all those things. You realize that now in rural, those are more prone to those teenage pregnancies.
Thank you so much, Dr. Wachiye. As we go on now, what are the implications for these teenage pregnancies, both in the social factors, in the social level, community level, maybe at the country level, economic level, financial? What are the implications of the impacts?
Okay, now looking at these implications, women, what does it mean when you have so many teenage pregnancies in the society?
Yes.
socially, economically, yes, health-wise, and so forth. So socially, when you look at this from the social perspective, when you have so many teenage pregnancies, one of the things that will happen in school, now, those who are in school, look at a girl who gets pregnant at 12 years or at 14 and she experienced those minor complications, minor ailments because of pregnancy, like nausea and vomiting a lot, choosing being so moody. You look at her when she's in school, there is drop in academics. So this girl will definitely drop in academics. This girl may drop out of school. This girl may have early marriages. This girl may have low esteem. And because of low esteem, she doesn't want even to stand before her peers. This girl may have, because of stigmatization, may end up being unhealthy, wholesomely. I mean, mentally, this girl may have depression. So because of those depression, definitely will drop out of school. And for us, when we look at we look at health as not merely because of the physical, how you're looking physically. We look at it socially. How are you able to socialize? Are you depressed? Are you becoming antisocial? Are you becoming immoral because you are under pressure somewhere? We look at it psychologically or mentally. Are you stressed? If you are stressed or depressed, we look at it. What can lead now? What are the complications of this stress? The end result of this may lead to now depression and even suicide. Someone may commit suicide. So the person who is pregnant, the girl, is generally affected from every angle. Socially is affected. Economically now, look at a girl now who will drop out of school. She doesn't have source of income. Yes. Now, economically, she's poor. Then she has a baby. Unfortunately, maybe the boy who impregnated the perpetrator is also a teenager. Is a teenager. If we look at it, this teenager, they will not provide for themselves. And when you look at now parental ignorance, maybe she got pregnant because of parental ignorance. Now the parent will not even mind. They will even tell her to get married. Or even now torture her, embarrass her. Now this girl will end up even in the street now, doing these street jobs at night. We call the commercial sex workers. This girl will be addicted to drugs now because someone who will convince her now, if you take alcohol, maybe your issues will reduce your stress. The end is that we shall have a very useless society, a very useless community where we don't have empowered girls who can take leadership roles. And the good thing with girls, when you get a lady who is a leader, it's normally true leader. So we shall have those gaps. Then when we look at gender equity and balance as Kenya, globally, we shall have an unbalanced society when we look at everywhere, every corner. So socially, we shall have all those effects. And to the boy will also drop academically because the boy, think of a boy who is told now, policemen are looking after you. This boy maybe is having an exam. Definitely this boy will not read. He will stay outside, he will stay in the maize plantations, he will have also stress, he will not concentrate. So when you look at the boy and the girl, all these people will be affected. And that's why when we address this, when you go to the community, we always give boys scenario where their only sister has been impregnated by someone. What is their take? Everyone normally says he has to go to clinic at least 8 times. He has to meet her doctor or her nurse at least 8 times. 8 times it means the more this girl meets with the health practitioner, gives a health talk, she asks questions, the more informed this girl is about her health, the more informed about danger signs, the more she'll be informed about the complications, the more she gets informed about how to prevent subsequent pregnancies. So the more that, so what are we doing that? Make sure that early identification in the community, at school. Teachers do help us identify these pregnancies. So what they do, no, they refer early enough in the facility so that this girl starts ANC services. She gets health talks so that she understands her health well. So she takes lead in making sure that she's very healthy. Yes. Apart from that, universal health coverage is there. Yes, to make sure
UHC.
everyone accesses health. Whether you are poor, whether you have money, whether you don't have. You make sure you go to clinic early enough, you deliver in the facility, you attend postnatal services, you get contraceptive services after counseling, and early enough so that we prevent these subsequent pregnancies and these maternal deaths. Yeah. So many things about intersectoral. Then now when we narrow down, like for us Transoya, what we are doing, because you realize we are at 18%. And when you look at that at around 2018, we were at 40-something%. So we have come from far. We are still going far. Yeah, and when you look at it, number one county in Kenya is Nyeri, is having 5%. Nyandarua is having teenage pregnancy coverage of about 5%. So Nyandarua, Nyeri, they are the ones that they have hit the target of less than, they're almost hitting the target of less than 5%. Then Transoya, we are at 18. We have even counties that are at 40-something. So Transoya, we are at around 20-something. We want to be number one. So what are we doing? Some of the strategies we are doing, apart from the ones I've mentioned, multi-sectoral collaboration, community awareness, school health program we are doing. We are liaising with the teachers. We are going there to make sure that we give health talks to our girls. We are liaising with pastors and in our churches so that once the youths close school, like along the day like December, we normally have youth conferences. So we are liaising with them so that we go there as health practitioners, we give them health talks, we discuss their sexual health life so that they are aware of these things. Yes, so school health, strengthening community awareness, matter-social engagement, we are doing what we call youth dialogues. We are going to the community to make sure we talk to the youths. We give them secret papers, they write health issues that affect them. That is where we discover, in fact that is when we discover that gender-based violence is happening. We have uncles, we have the fathers who are defining their daughters, their stepdaughters. So we give them secret papers they just write because we always make sure that it's private and confidential. Yeah, so we are going to the community, we discuss those, we discuss about menstrual hygiene, we discuss about that. We discuss about those, they share the possible causes that are making them impregnated early enough. Then once we get those causes, now we address. One of it that have come out in the community is parental guidance. Like here in Transoya, it's really one of the issues affecting. So once we have parental guidance, now we organize and have male engagement forums. Male engagement forum means a male health talks, where we invite men in those villages. We have a health talk on parental care, so that they know how to parent their children, so that they don't disappoint good parents. Yes. Once we identify the issue being the peer pressure, we discuss about the youths, about the peer pressure, how the social media is affecting them. Yeah, that is one of the things we are doing as Transoya. That's why we have seen us moving from all the way from 40-something to around, from 44 to around 18%.
Wow.
Now, this year 2025, we have had challenges. One of the challenges is stoppage of USAID funding. When Trump was sworn in,
yes, I know.
some of the things happened. So one of the issues, one of the bad effects, one of the challenges that now happen is we have had non-governmental organizations, USAID funding, that have been helping us as Minister of Health doing those community engagement forums, going to the community, talk to youths, going to so you realize that stoppage was there. So somehow we got stuck. So that process, now confusion, so now the devil comes in, benefits from that confusion. Now we have had now an upside, the numbers have now started coming up. So what are we saying now? We are calling upon the community now to please take lead. If your girl has been impregnated, don't get that cheap 50,000, 20,000 so that
The case is
so
finished.
the case is finished at local level. Let the law take its course, so that we have a health, so that people learn the lesson that if you do this, that will be the bad experience. If we do that, that will be verified. And we thank the media because you're also helping us, giving us forums so that we educate our people. Yeah, even the Bible says our people get lost because of lack of knowledge. Yeah, I'm not a bishop, like I know that once. So knowledge is power. Let people be empowered so that together we reduce teenage pregnancy. Yeah.
Wow. I'm so grateful, Dr. Wachiye. That was very comprehensive.